want to thank the rest of today's speakers as well. You have provided incredible insights into best practices, opportunities, and challenges faced by moving our collaborations, research, and interactions online during the pandemic. Just some of the highlights of the day. There were many, many such highlights. The day began with Senator Colin Deacon. We had a fascinating exchange on getting researchers and families together in the same room. He talked about the dangers of patents getting in the way of other priorities, and he talked about a flight of capital and ideas out of the country that I thought was like the spur of what could have been a longer conversation. It was a perfect segue to the morning panel that introduced us to apps that provide coaching online during the pandemic. And the two apps, of course, that were discussed were Dino Island, designed to improve executive function, and Better Nights, Better Days, designed to improve sleep. These are high-impact apps that affect large numbers of kids with neurodevelopmental disabilities. Some of the things that were discussed during that session: a lack of evidence-based apps, the value of giving communities early access to these kinds of apps during the development process. That is, early success is good, but one of the things that was considered a challenge is to sustainability and rollout, and those are important next steps following early success based on research. One of the points that was raised during that morning session was a lack of alignment between people in academia and entrepreneurs, and then that final admonition to pick your partners well, and a reminder that scaling innovation continues to be a challenge in Canada. And that took us to the afternoon session. And up first, we had 7 MyTax interns. MyTax, of course, is the key link between industry and post-secondary institutions. They presented challenges that are presented by COVID-19, perspectives on implementing innovative solutions to mitigate the challenges faced by children with neurodevelopmental disabilities and their families. Really 7 incredible research projects, including emphasis on mental health and well-being in kids who have ASD and their families, CASDA development of a national autism strategy, and evaluation of 3 ABLE2 programs, capacity building during the pandemic, information needs for individuals with neurodevelopmental disabilities during COVID. Other points that were raised: satisfaction with services during the pandemic. That was another one that was discussed. Stressors that the researchers mentioned included lack of access to services, including mental health, uncoordinated research, lack of sharing of research, transition to online, lack of resources, and a need for better preparation for research among policymakers. After hearing from the interns, we heard from their partners. All of them were blown away by the quality of the research that was conducted, and they cited lots of challenges and lots of opportunities. And that brought us to our final presentation, challenges of moving research online during a pandemic. And some of the themes that they talked about, having to stop and pivot to remote data collection. That reminds me that now I'm speaking as Brian Goldman, book author. I'm writing a book now. This is my 4th nonfiction book. It's the first in which I have to conduct most of my book research virtually instead of in person. And so I can certainly appreciate the limitations there. Cognitive psychologists on the panel talked about pivoting from coming in person to online. The benefit is that you can collect data in multiple locations at the same time. But the downside is that you may not know who is actually entering the data. It could be a parent. It could be a child who's at the age of 5, or it could be a parent. Beware if the data was collected at 3 a.m., unless, of course, your child is a night owl. I'm being only slightly facetious there. Keeping in touch with all researchers remotely is, of course, a challenge during the pandemic when you can't meet up in person. There was a discussion of EEG and functional MRI research that is, of course, limited during the pandemic, and the need to pivot to other experimental models, including behavioral experimental design. Behaviors can be measured, so can other things that can be measured as well. And we learned about platforms like Pavlovia and PsychoPie. The point that was raised, there are benefits here that the research can be extremely cost effective. And what I heard was a realization that while there are challenges, there are opportunities. And there's a saying here: when life hands you lemons, you make lemonade. Some of the other concrete issues that were discussed in the panel included data storage, data management, data privacy, the trustworthiness of the data, and then some final take-home points to conclude the day. Start early, write a book about how to move research online, stay connected with your team, take advantage of the new opportunities. We heard that again and again. So really, it was an incredibly productive day. Before I sign off day 3, a huge shout out to our sponsors once again: Simon Fraser University, Claret, the Azrieli Foundation, CanFASD, Queen's University, Holland Bloor View, Kids Rehabilitation Hospital, Ontario Centre for Excellence for Child and Youth Mental Health, Gathertown, Family Support Institute of BC, and the Michael Smith Foundation for Health Research. We now invite you to join us on the KBHN networking space for our final round of virtual poster presentations. Please go and see the great work. Support that work that's being done by our poster presenters for this conference. And by fabulous work, I really mean it. The level of excellence of these posters and videos is amazing. Today, you can catch Elizabeth Key's poster on child sleep in the context of COVID-19, and Chantal Ritter's recommendations following FASD assessment in Canadian diagnostic clinics. So go grab your avatar, hop on the KBHN networking platform as soon as I'm finished, and watch their walkthrough video, followed by an in-depth one-on-one discussion with poster presenters about their research. And then join me back here tomorrow at 11 a.m. Eastern Standard Time. That's 8 a.m. Pacific Time for the opening ceremony of the final day of the KBHN conference, where we'll explore policy and decision-making in a COVID-19 world. We'll have integrating rights-based frameworks into policy and practice. We'll also have the road to Canada's National Autism Strategy, and of course, the Family Partner Pitch Sessions. As discussed, the Family Partner Pitch Sessions will take place at the KBHN networking space during our exhibition and networking session between 1 p.m. and 2 p.m. Eastern Time. That is 10 a.m. and 11 a.m. Pacific Time. And let me tell you, you don't want to miss these creative and insightful pitches. For now, I'm Dr. Brian Goldman. I'm signing off for today. See you tomorrow for day 4 of the Kids Brain Health Virtual Conference. Take care, have a nice evening, and we'll see you tomorrow.